Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Good afternoon, everyone. I am Karsma Pratama from Stik Muhammadiyah Pontianak. In this video, I would like to show to you about my recent study. My study was nursing staff competency on prevention for risk ulceration on diabetic foot patients. We know that the DFU or diabetic foot ulcer affects quality of life of the M patients, and it increases morbidity and mortality, and then also leads to substantial economic burden for patients. The DFU is not only affect to the DM patients, but also affect to their families and society. Food problems account for up to 15% of healthcare resources in developed countries and 40% in developing countries. And NDFU can cause the amputations, and of course it needs nurse to prevent and protect them from complication. The role of the nurse in DFU includes diabetic foot examination and wound care, advise appropriate food care and regular follow-up to the M clinic. Significantly, assessment is early detection for DFU and those at risk, as well as planning to reduce the risk of ulcers according to risk factors identification. The aims of the study were to investigate nursing staff competency of diabetic risk assessment, diabetic risk classification, and diabetic food intervention in diabetes mellitus patients. For the methods, there were 127 nurses who involved in the study, and the guideline for diabetic foot ulcer prevention was distributed to the nurse, and then they were trained how to apply the guideline for the AV preventions before they applied to the DM patient directly. And after training, all nurses' competency were evaluated by nurse competency form. The nurse competency form consists of 20 statements which related to the step of DFU prevention. Okay, the result of the study, also of the nurses had ability in implementing the guideline for DFU prevention in DM patients. Regarding performance level, there were 53 nurses had good performance, 62 nurses had satisfaction performance, but unfortunately, there were 12 nurses who had poor performance. And the nurse with poor performance were trained until they pass and meet the satisfaction level. For the discussion, only 12 nurses who had not reached the satisfaction level and were trained by their nurse. Possible explanation is that working experience in taking care of the patients and training certificate of wound care are also factors supporting the nurse's ability. In this study, the median years of working experience in taking care of the patients was 6 years and ranged from 1 to 10 years. And then the 102 of nurses who had not wound care certificate. And then the 12 nurses who did not pass in the first training were the nurses who do not have wound care certificate and have less experience in taking care of the patients. The study finding of Blegan, Foff, and Good found that the higher proportion of nurses with more than 5 years of experience was associated with fewer errors. Okay, in conclusion of the study, 127 nurses who implemented the guideline had been trained by the researcher, and the nurses had tried out the guideline in the patients. And in the last, there were 12 nurses who had poor competency level, and they were trained by the researcher. Okay, this is the diabetic foot ulcer prevention program. You can see this. There are diabetic assessment, diabetic risk category, and then some form interventions based of diabetic risk category of diabetic risk classification. Okay, that's all my presentation. Okay, thank you for your attention. Assalamualaikum warahmatullahi